Good evening, everyone. My name is Gwen Webber-McLeod. I'm the president and CEO of Gwen Inc., a private sector leadership development corporation that's based in Auburn, New York, the chosen hometown of Harriet Tubman. I also happen to be a former president of the Auburn-Puget NAACP and continue to be a supporter of this very important national organization. I am so honored to have been asked to be the moderator of the COVID-19 Community Dialogue hosted by the Syracuse chapter of the NAACP. This is, as you all know, this is an unprecedented time for our country and our community. And we were faced with a health challenge like none other I've ever seen in my lifetime, and I'm confident for most of you, not seen in your lifetime. And it's really important that your local NAACP chapter is taking this opportunity to allow you to hear from experts who have specific information about the impact of COVID-19 on communities of color. I'm going to be introducing Linda Brown Robinson, the president of the Syracuse Onondaga chapter of the NAACP, to make some opening remarks. And then following that, we'll jump right into your panel to hear from our panelists. There'll be an opportunity for you to share your questions, your comments, your concerns with us. I will field those questions with the panelists. And my hope for all of you is that this is a very informative opportunity, that you take some information away from this that you can apply immediately in your lives, in your work as social activists, justice activists, and within your communities as well. So with that, I'd like to introduce Linda Brown Robinson, who will make some welcoming remarks on behalf of the chapter.
Good evening, everyone. I'm Linda Brown Robinson, as Gwen said, and I'm president of the Syracuse Onondaga NAACP. I would like to thank you all for joining us across the platforms of Zoom, Facebook, Live, and YouTube. This evening, our panelists will help you sort out how and why this horrific nationwide pandemic is not only affecting communities of color nationwide, but widely affecting our own central New York communities of color as well. I would like to thank the governor of the great state of New York, Andrew Cuomo, County Executive Ryan McMahon, for their informative daily briefs, as well as our own mayor, Ben Walsh, for providing us with much needed ongoing comforting information. Additionally, I would like to thank Attorney General Tish James, who continues to police those who are taking advantage of the most vulnerable residents of the New York State. As the discussion proceeds, please provide us with your questions for our panelists. Before I turn the program over to this evening to the moderator and my friend and colleague, I would like to introduce you and tell you a little bit about Gwen Webber-McLeod. As she said, she's the president of Gwen Inc. Gwen is an experienced leader, facilitator, coalition builder, lecturer, and keynote speaker. Her clients include CEOs, executive and mid-level managers, and leadership teams in public, private, healthcare and education, business and organizations. Gwen is recognized professionally as a leader who has a very active life. She takes great pride in serving on boards of directors that enhance and improve the lives of the people at the local, state, and national level. Without further ado, I will pass this back to Gwen Webber-McLeod. Thank you, Gwen.
Thank you so much. Next, I'm going to invite Mayor Ben Walsh to join us. He is here on behalf of the city of Syracuse to make some remarks. And Mayor, welcome to the COVID-19 Community Dialogue. I am a fan of yours from Auburn, New York, and keep my eye on the things that you're doing in Syracuse. And I've been particularly impressed with how you've been collaborating with the county to make sure that the citizens of the city and in partnership with the county exec, Onondaga County, are doing well. So I'd like to invite you to bring some words of encouragement, inspiration, and to share your perspective about the impact of COVID-19 on the city of Syracuse.
Thank you, Gwen. Good evening, everyone. I want to thank the NAACP, Linda Brown Robinson, and everyone for bringing us together this evening. Over the past month or so, one of my observations has been people just have this insatiable appetite for information. And it's so critical that we deliver good, sound, factual information to people that then they can share with their families, with their friends, and with their networks. And so I'm thrilled that the NAACP stepped up and is using this as an opportunity to share that information. As you alluded to, Gwen, as far as in our local community, I've been very pleased with the level of coordination and collaboration, not only between the city and the county, but the city, the county, and the state. We're all in regular, really daily communication with each other, and understanding none of us have an instruction manual for what we're dealing with. I think all things considered, we're doing about as well as could be expected. We've tried wherever we can to be proactive, to plan for to plan for all of the different challenges. I think that the county was, when I talked to other mayors around the community, around the state, the county was very smart to get the drive-up triage testing center open as quickly as they did, and also to have it located where it is centrally located, where people that may not have access to private transportation may be able to access it through public transportation or walking. That's been very helpful to us. The work that we're putting in to prepare for the economic recovery, I think, is going to pay dividends when we get there, understanding that we're not going to get there until the health data tells us that we can get there. So overall, again, our job is to just get information out to people. That's what you all are doing here, and we know, and particularly as the mayor of Syracuse, one of the areas that we don't know as much as we should and as much as we need to know is how this virus, how this pandemic is impacting communities of color. It's something that we're studying very hard. We're working with the county to access data to inform our decision making, but it is certainly an area of concern for us, and an area that I hope to learn myself more about this evening, and hopefully others as well. So again, thank you for the opportunity, and thank you for all of the presenters and for everyone tuning in.
Thank you very much, Mayor. I'd like to briefly just mention the names of all of our panelists, and then we're going to dive right in. So on with us, we have Dr. Michael Schiano, and we also have Dr. David Davin. We have Bishop Colette Matthews. We have Dr. Sharon Brangman. We have Elisa Morales. We have Gary Williams, who's the chair of the Health Committee for the local NAACP. We have the Honorable Pamela Hunter. We have Lorraine Braithwaite, who's with the New York State chapter of the NAACP. We also have Joan Buckley White. As we get into the presentations and the questions, I will be saying a little bit more about each of our panelists. Mayor Walsh, I think you mentioned something that I know in my own business working with leaders is of critical importance. And during a time like this, what people really need from community leaders and statewide leaders, national leaders, is information, encouragement, and support. And that's exactly what the COVID-19 community dialogue has been designed to do. So I'd like to begin our panel discussion by introducing you to Assemblywoman Pamela Hunter, who also happens to be one of my favorite women leaders in this area, and someone I consider a sister girlfriend, as I say, with my circle of women friends. The Honorable Pamela Hunter is a member of the New York State Legislature representing the 128th Assembly District. She is the female veteran in the New York State Legislature. She chairs the Assembly Subcommittee on Women Veterans, working to expand access to benefits and services and improve job opportunities for women who have served our country. She also serves on the Energy, Insurance, Social Services, Transportation, and Veterans Affairs Committees, and she is a member of the Black and Puerto Rican Legislators and Women's Caucuses. Thank you so much for joining us, Honorable Hunter, Pamela Hunter. We're so excited you would be here tonight, and we specifically would like to ask you to begin by addressing something. What specific things do you think people in your district need to know about our government's response to COVID-19?
Well, good evening, everyone. For everyone I can see and for everyone who is listening in whatever social media forum, I'm glad that you're able to tune in, Linda, when she calls and asks if someone can join. You never say no, so it's wonderful to be able to participate this evening. It's very timely, especially as one of the things you mentioned, I do belong to the New York State Black and Puerto Rican Hispanic Asian Caucus, and as we're talking about disparities in health and community of color and access. One thing that is important to know is that we are listening. We're listening to concerns, but not just listening, putting actionable plans in place in order to really reach out and touch those communities that need it most. Just recently, we were on a call yesterday, and one of the things that we talk about is disparity in access in healthcare, which you have plenty of healthcare providers on here today, which I'm sure they'll talk about as well. We have significant issues with unemployment. As you can see the statistics with death rates, that they are highest in New York City with Hispanics and African Americans. And so we're having conversations relative to what it looks like with funerals, what it looks like for burials. There is a huge issue relative to what's going to happen with the housing crisis and what we can do relative to this 90-day moratorium on evictions that happens. That's going to be coming up relatively very quickly, and also education funding, disparities with broadband, people not being able to have access to technology for learning, and all of those really impact communities of color the most. And it's interesting because outside of New York City, aside from myself, a member in Rochester and a member in Buffalo, we are the only people of color that represent outside of New York City. And sometimes our voices are not heard. And our communities need help now more than ever. Yes, we've done a great job relative to keeping infection rates, very low. We've done a great job, making sure that people are, applying with social distancing. But what comes next and how we lead going forward will speak volumes.
So I want to thank you so much for that. And what specific types of things would you encourage people in Syracuse and Onondaga County to be paying attention to? Because that's a broad range of issues. Some of them I think might be more relevant for your immediate district than not. So what would you encourage local leaders, local activists, people right on the ground and in homes to be paying most attention to for this immediate area?
I would say food disparities. We have a significant issue with people not having access to food, healthy food. It seems that even though we see that there has been deliveries of milk and there's ways that people can go to SUNY Morrisville maybe every other week, but food disparity is very real, and that's a significant issue right now. The housing issue is very, very real right now. Even though people are in process with unemployment, which, no one could imagine that going from 60,000 people to 1.5 million people, the technological system wasn't able to handle it. And we promised that they're going to get to every person. But being able to have those conversations with your landlord and your debt collectors is going to be important, because the moratorium is on evictions. The moratorium isn't on paying your rent. And what happens if you haven't paid your national grid and you haven't paid your landlord? We've had situations where people's provider, their primary care provider office has closed. And that they are having layoffs. And so specifically in this area where people already had healthcare disparity, now that they're concerned about how do I get to my primary care doctor? So those are some specific areas, especially that relate to where we live, that people should be aware of. And this group of folks on here today can definitely speak to.
Great, and I would like to say to the panelists and everyone who is listening or watching that throughout these presentations, you'll have the opportunity to send questions into the NAACP. And as we get through the panelists, I'll be going through those questions. If you have somebody specific that you'd like to ask a question to, please include that in your question. If not, I will do my best to field the question with the resident expert that's joining us this evening. So the next person that we have is the New York State NAACP Health Chair, Lorraine Braithwaite-Harte. Lorraine Braithwaite-Harte is Health Chairman for the NAACP New York State Conference. She is also the first Vice President of the Brooklyn branch and a member of the State University of the new Downstate Health Science University Community Advisory Board. During her career, she has addressed the following inequalities: childhood obesity and diabetes, funding for HIV/AIDS, lack of services for sickle cell anemia patients, and the disproportionate marketing by big tobacco of menthol flavored products and flavored e-cigarettes to youth as young as 12 years old. Good evening, Lorraine, and thank you so much for joining us.
Good evening, and thank you for having me. It's a pleasure.
Thank you so much. As the branch was organizing questions, we wanted to not only lean into your expertise, but when I look at the health issues that you've really been focusing on, and they're all impacted by the health disparities that exist under normal circumstances that I'm sure are all exacerbated by the COVID-19 pandemic. One of the things we wanted to ask you about, because of your state involvement as well, is what are the social justice issues you see the NAACP monitoring in New York State as it relates to COVID-19? And as much as you're familiar with upstate New York, which for us begins like around Albany,
Exactly.
you all in someplace else.
Yes, I know that.
Yeah. We'd like to know if you are seeing anything specific with that. So what are chapters reporting? And I think all of your areas of expertise are relevant to asking us to take a look at these as social justice issues as well.
Right. Okay. So I just want to make a little correction. We're not chapters anymore. We are branches.
Branches. Thank you.
Okay. So that works. And we speak branches. It's interesting. I've looked at what's going on upstate New York versus New York City. And although New York City, all of the issues are compounded and are severe, upstate is having similar issues, but not as in the magnitude that they exist here in New York City. If you take Buffalo, the one good thing about Buffalo, their nursing homes, in Erie, I think it's Erie County, they're not having any cases of deaths from COVID. Versus New York City, I mean, it's astronomical, the deaths. We are burdened to the max. Bodies are not being picked up on time. Even workers, employees of the nursing home have died within the nursing home setting, and they are in the pile of bodies that need to be moved out. That's really tragic. The criminal justice system area, New York City now, they're looking into the issue of letting prisoners go that are not criminals in the sense of hardened criminals. So because the criminal justice system is so burdened, there's no ability to space people out properly. And you have cases where deaths have occurred with people just short of being released. Okay, so upstate New York, because they're not as overcrowded, they are now releasing prisoners that have a shorter span of time to be incarcerated. So the attrition rate is better. So although the cases are not as much upstate, they are having similar issues as we are having downstate. Not enough protective clothing for the workers, the first line responders. You're having issues of not having enough food for those who are homebound. The children are not in school, so that although we are having ability to go to the schools and pick up the food, that's still an issue. So there's so many similarities in what is going on, and we are looking to see where these problems. We want to know that reporting is accurate. A lot of people are dying at home, and so you don't know that their deaths are also COVID deaths, because so many people are showing up at the hospitals and they're being told, no, you're not sick enough. And there are cases of people being turned away and then they go home and they die right there. So the numbers, we want accurate reporting of what's going on with this. So that is essential. Demographics, who is really dying and why are they dying? And now there's studies that are showing the three conditions, the three comorbidities that are causing the highest rates of deaths in Black and brown people are obesity, diabetes, and hypertension.
Mhm.
Those are things that we know exist in our communities. And so now we find ourselves having to really tackle, we have been tackling this. The NAACP has had programs to deal with childhood obesity and family obesities, adult obesity. Now we can no longer just say, okay, we're going to do a program. We now have to really dive deep and address these issues that are nutritionally based. A great deal of people are now in the hospitals that are needing to be on dialysis. And last year, one of the things that I wrote a resolution for was on stemming the tide of chronic kidney failure in the Black and brown community. Mm-hmm. And now what are we seeing? Kidney failure in these same patients. This can no longer continue like this. We have to do something about it.
Thank you. I've been thinking about this a lot, that I think that the health issues that are pretty much prominent in the minority community and communities of color are always issues. And it seems to me that they're being exacerbated by COVID-19. So as you all are working with branches across the state about these issues, what are maybe 2 or 3 specific things you're encouraging NAACP branches to be doing at the community level to ensure that these disparities don't again get lost in the chaos that's being created in the health system by COVID-19? What can branches up this area do?
Demand that your politicians, which is where the policies get made, that you have proper health care coverage for the minorities, for the working poor, for those who have no insurance. The insurance issue is a huge one. You must demand that these services are there for those who are disenfranchised. Mm-hmm. And that's the poor, congested Black and brown communities.
Yes.
All of the factors that are in there, they are all a microcosm of everything that's happening to us.
Mm-hmm. Yeah, I would agree with that.
Yeah, and without having the political might presenting to hold your politicians accountable. These are the issues in our community, and we demand that these things get fixed. And like you said, or was said prior, if these issues are not addressed now, after COVID is over, there's going to be another tragedy coming to us. Mm-hmm. And we're going to be the same people, once again, without health insurance, without proper transportation, without proper food. Overall, education, the education issue is a big one.
Yes.
Everything is all encompassing in keeping us in the condition that we're in. These are all social determinants of health.
Thank you so much. I actually, in my business, work with a lot of healthcare leaders, and the social determinants of health are really impacting everything, including how health organizations are being paid in the future. I think that's happening now. And we are so fortunate to have with us tonight a number of physicians and people who are working in healthcare that can also shed some light on some more specific details. And I'm so excited that you can share your collective expertise. So the next person that we'll be hearing from is Dr. Michael Schiano. And if I'm not pronouncing your name correctly, doctor, please say it when you introduce yourself. I'd like to read a little bit of your bio. So Dr. Michael Schiano is Chief Medical Officer, Chief Adult Medicine, and walk-in care physician at the Syracuse Community Health Center here in Syracuse, New York. Dr. Schiano's private practice specializes in internal medicine. The Syracuse Community Health Center opened the coronavirus testing site in Syracuse on March 16th, 2020. The new site opened the same day as the first case of the novel coronavirus known as COVID-19 was confirmed in Onondaga County. Dr. Schiano is committed to heart health through the Million Hearts Initiative. That resonates with me. I'm very involved in Go Red with Women. Thank you so much for taking time to join us this evening. And as we were again looking at our questions and trying to get people to kind of laser focus on some things, one of the things we'd like you to speak about is we're hearing constantly every day on the news about testing and the importance of testing and the role that testing will have in a community's ability to reopen. So you sound like you're right in the ground level with some of this. And what we'd like you to talk a little bit about, and then please feel free to expand on, what are the challenges for access to testing for the people you serve at the Syracuse Community Health Center? And doctor, I'm not assuming that everyone understands the demographic of your patients. So if you want to speak a little bit to that as well, that would be helpful, I think.
Sure. First of all, thank you very much for having me. I feel honored to be here tonight and welcome everybody. The challenges for access to testing is a very important aspect of fighting COVID-19. As we hear from the presidential, from the governor's speeches daily basis, testing is how we're going to help to mitigate this disease process. It's a very important role in mitigation of COVID-19. We need to continue to move forward with this, and we're looking at challenges that we have, which is going forward, trying to break those challenges and those barriers to ensure that access is going to be given to all. When we look at the challenges to access, the first starts with, do we have access available? As Mayor Walsh has stated, and you also stated, we were the first here to team up with Onondaga County to be the first on the scene to make sure that we were involved and that we had a place for testing in the heart of Syracuse here, where we have a population that is in need of making sure that we have access for people in the surrounding area codes that are here in Syracuse. We were first to the scene. We put together a quick access point for us immediately. We've worked closely with Upstate and as well as the county, having access for both walk-in patients walking in off the street, as well as cars to drive through, to make sure we had access for testing that way. That was the first part, was making sure that we had access for our patients. Some of the tougher parts of access and challenges that we've been finding that we face are some of the educational pieces. Although there's access for all of our patients, it's free to them, there is no charge. People knowing whether or not they should come down. Should I come down to get tested? Is it necessary for me to be tested? Are they watching the news? Do they know the information on the symptoms of whether or not they should come down to get tested? So the educational piece to our patients has been a focus. That's been a little bit more of a challenge, to make sure we're reaching out to people to educate them when they need to ensure that they are coming down to get tested. Secondly, another barrier that we've been looking at is things like childcare. In our community here, people are often essential workers. As we know, people of color make up 41% of the healthcare workers, as Governor Cuomo just recently stated here in New York State. That means there's a lot of essential healthcare workers as well as other fields. And when you're an essential worker, you may not have access to childcare when you do get home and being able to come over and get tested. So childcare, we've run into trying to get people down here and having issues with childcare. And the third thing, we've run into some cultural and religious issues is, I'm afraid to get tested. If I get tested and I'm positive in our community, is that going to mean it puts a stigma on me if I'm positive for COVID-19? So some of these type of challenges are what we see as far as testing. Physically, we are located, here in the heart of Syracuse. We do walk-ins. We do we have access for cars to pull up and come through. Again, it is free for all who come through. So we do have physical access, but we do have barriers that we need to overcome that we are working on.
And are you seeing people taking advantage of the testing opportunity? Yeah.
Yes, we do. If for those who watch Ryan McMahon's daily press conferences, we do about half of the tests that are currently done in Onondaga County. We make up about half of those tests that have been done so far. So we are making a dent. We are making a large dent in that.
And I think something else related to this topic that I'm seeing trending nationally, and I'm wondering how it's playing out in this part of in our area of upstate New York. Do you have enough of the test to do the work that you're being charged to do?
Tests themselves, in the beginning, tests were very tight. We got to a point where we did have sufficient numbers of tests. It's up and down a little bit. Some of it's the testing supplies, actually. Some of the actual swabs to do the tests. We had the serums, but we didn't have the swabs. Currently, we do have plenty of tests to do. We have enough tests right now to do what we need to do. So we see that flow has been fairly stable.
Great. I'm glad to hear that. I think that that's a really important piece of information because, as you can imagine, I'm sure you experience too, there's so much confusion about what we have enough of, what we don't have enough of for the general public. And I think that your organization provides a very important and critical service to a very important population of people in our community. So thank you so much for that. And as the questions come through, Doctor, I'll get right back to you. Did I do all right with your name?
You did fine with my name. I do want to just do a shout out to thank Ryan McMahon and the county that have really helped to make this happen and helped to keep trying to provide those tests, to give us enough tests to keep our community tested. So they've done a great job and we keep pushing forward. So
thank you so much. And we're hoping that County Exec McMahon will have an opportunity to join us if he has time to do that this evening. So if not, somebody will let him know that you shouted him out. So next, to continue with our health professionals, I'd like to introduce Dr. Sharon Brangman. And Dr. Brangman, Sharon Brangman, is the director of the Geriatric Medicine Fellowship Program and professor of medicine and the head of geriatric department at SUNY Upstate Medical University. A leader in the field of geriatrics, Dr. Brangman developed the Division of University Geriatricians, you have to correct me on that one, at Upstate Medical University, the most comprehensive ambulatory practice and interdisciplinary team in geriatric medicine in the region, a nationally recognized expert on Alzheimer's disease and the cultural issues of aging. She is a powerful voice in Washington, D.C., advocating for healthcare reform, independence, and quality of life for all older people. Welcome, Dr. Brangman. It's good to see you again.
Thank you for having me.
Thank you so much. Well, Assemblywoman Hunter was really talking about, and also Lorraine Braithwaite-Harte was talking about the impact COVID-19 is having on elders in our community. And I'm so excited that you could be here to share your expertise with us. So I'm going to start by asking you a question, but you are a fountain of knowledge. So please feel free to expand on this in any way that works best for you. But where we'd like you to start is just this whole question of nursing homes, for one thing. And I know that a lot of families either are having people at home, right, keeping folks at home, or have families who are actually in facilities throughout our region. And what we were wondering about is, what should we look for when we have loved ones in nursing homes? And what other talking points should be included in surveys, and if we're keeping people at home and those at high risk? So I'm going to allow you to, I wanted to frame that for you, but please feel free to share your information from your point of view.
So thank you, but all of my patients are high risk. Clearly, being older, and in most of these studies, they include people who are 60 as geriatric. But in reality, my practice is usually people who are in 80s and 90s and higher. And so just by their age alone, they are at higher risk, and often they have the other diseases such as diabetes and hypertension and dementia, cognitive impairment. These all put people at risk. One of the things that we have started to see is that the classic symptoms of COVID do not appear in older adults like they might in a younger person. So if we're looking for a high temperature, that is not usually the first sign in my patients. Many of my patients already have underlying heart disease and lung disease, so they may already be short of breath, they may already have a cough. So if we're looking for these classic symptoms in older adults, we will miss them. And that's why testing is so important. I try to keep my patients home. We don't want them in the office. We don't want them in the hospital right now. But I think that we have to look at how we are evaluating who has symptoms, because older adults have unusual or atypical symptoms. And sometimes it could just be confusion. They're not acting their usual self. They may be more unsteady on their feet, a little weak, very, very non-specific things. So if you're waiting for a high fever or a cough or shortness of breath, we will miss it. Now, nursing homes particularly are under stress. Even before COVID, they were under-resourced and understaffed. And now with the stress of this illness, we have just seen this come out. So this pandemic is showing us all the vulnerabilities in our community. And it's usually the people that are on the margins who are already most vulnerable. And then add to it that all nursing homes had to stop visitors. So this made a lot of family members very anxious and stressed because they couldn't go in and visit. One of the things that we forget in nursing homes is that there are people there who this is their home. They are usually served by home health aides, nurses, who are often single mothers who have been impacted by schools being closed, so they may not have childcare. They're often caregivers who use public transportation to get to the nursing homes to take care of these patients. So we need to do testing. And if we're waiting for the classic symptoms, we're going to miss people. I think nursing homes need regular testing of staff as well as patients so that we can identify who may have the disease. And then many nursing homes have started to create separate wards to keep people who are COVID positive in a separate part of the nursing home so that they don't infect others. This is the same thing is true for assisted living facilities, adult homes. I have patients who have developmental disabilities who are older and geriatric, and they live in group homes. All of these places, I think, fell off our radar at first, so they may not have been given masks, PPEs, the staffing issues weren't addressed, and so now we are seeing the results of that. Central New York and Onondaga County has not been hit as hard in terms of nursing homes as downstate, but there are cases of COVID in assisted living and nursing homes here in Central New York. So we want to work really hard to kind of keep that under control. And I think this is where testing is so important, which we've heard others mention tonight. Our office has switched to telemedicine. We did, as one of my colleagues put it, we did 10 years worth of work in 2 weeks. However, this has also highlighted some of the disparities because I have older adults who are not technically skilled. They may have some level of confusion. They could be hard of hearing. If you've ever tried to talk to an older relative on the telephone, you know how hard that can be. And if they do go into the healthcare system, and people are talking to them behind masks, that can increase their confusion. Not all of my patients have smartphones. They don't even have internet service. So this is going to highlight the disparities of accessing care if we end up doing telemedicine for long periods of time. And I think this will be true for both marginalized ends of our healthcare system, which are usually children and older adults. So when we talk about a one-size-fits-all and we're all in this together, that's true to some degree, but then that makes us overlook some of the disparities and some of the individual characteristics that we need to address so that we can really reach out and take care of our patients in a very individualized way. In geriatrics, we always knew one size doesn't fit all. A 65-year-old and a 95-year-old, even though they're all in that geriatric age group, have very different needs, and their problems need to be addressed in a very separate way. We also are the site for the Upstate Center of Excellence for Alzheimer's disease, and when you add any kind of memory loss to a COVID pandemic, you can imagine how much more difficult that is. So I have patients who need physical cues to get through the day. We need to set up ways of having reach out to people who are physically isolated. isolation for older adults can be just as deadly as a heart attack or as smoking 10 or 15 cigarettes a day. So I want us to think of this as physical distancing, but not social distancing. So we have to still have ways of connecting with older adults so they are not isolated. And especially if they do not have technology, this can end up being very deadly. So I'm taking care of patients, trying to keep them at home, and we have to make the decision of bringing home care into their home, which has some risks associated with it, but without that extra help, they will have to go to the hospital where we don't want them to be at this time.
Mhm.
So we have to look at our community resources to reach out to older adults so they aren't isolated and their needs are getting met.
Thank you so much. And I just want to remind those of you who are participating that we're seeing your questions. We're getting near the end of our panelists, and then we'll open the floor up for more conversation. Also, those of you joining or can call today have your microphones and things are muted, but we really want you to go ahead and use the Q&A tab to get to us. Also, this webinar is being recorded, so for people who might want to see it again to get the information, that will be available to you. So we're going to continue. We have a few more panelists, and then we'll get you back involved in the conversation. And again, I want to welcome everyone to the COVID-19 Community Dialogue that's being hosted by the Syracuse Onondaga branch of the NAACP. I got it right, Lorraine. So next we have Dr. David J. Davin. Dr. David Davin is an attending physician at Crouse Hospital. He practices pulmonary medicine and inpatient and outpatient sleep medicine in Syracuse, New York. While affiliated with the Community General Hospital Sleep Center, he was the director of sleep services. He has served as consulting staff pulmonologist at Albany Medical Center, medical director at Crouse Hospital in the Department of Cardiopulmonary Rehabilitation, and as medical director at Crouse Hospital Home Care. Welcome, Dr. Davin. How are you?
I am heartened. I must tell you, I was pretty discouraged as the day progressed, but hearing what you had to say, Gwen, as well as Lorraine and Mike and Dr. Brangman, has really given me some encouragement. I'm actually in a position to recommend, make a public health recommendation to help deal with the atrocious morbidity and mortality of this illness. Ironically, one of the biggest drivers of illness, severity, and mortality turns out to be nutritionally based. And that's why I kind of leapt with joy when I heard Lorraine mention nutritionally based solutions. Malnutrition has been an issue here. Obesity has been a major driver of risk and mortality across all communities. And this is something that as a sleep specialist, I deal with all the time, treating sleep apnea. So I've been following this issue of obesity and morbidity and mortality. And I explored the question of what immune defect does obesity create in an individual or a population that's overweight. And it turns out that we've got a treatable immune defect, and that has to do with the gut microbiome. It has to do with the bacterial population in our GI tract. That's compromised, and when it's compromised, the person's ability to mount an immune response to a viral infection is compromised. And it can be fixed with something as simple as a probiotic that contains lactobacillus. And we know that when you give probiotics to people that have altered gut microflora, you can actually enhance their immune response to viral infection, specifically what's called the interferon response. Now, as my nutritional consultants to this practice remind me, David, you can't give a probiotic without preceding it with a prebiotic, which is a fancy word for vegetables, which is why I presented to Sherry and Linda this scenario that took place in 2012 about Wegmans pulling up stakes on Pond Street and depriving a community of nutrition-dense foods and leaving behind calorie-dense foods. Because right now I can tell you that if I could wave a magic wand, I would give everybody vegetables and fruits in that order, not fruits and vegetables, vegetables and fruits. I'd follow it up with a probiotic. We could literally assess their immune function and their lung function as we move forward. And we could literally attack this from a community-based nutritional program, such as Geisinger Healthcare has 3 hours to the south of us in Pennsylvania.
Mm-hmm.
It's called food pharmacy. And I'm sitting in front of my TV crying my eyes out every day, listening to the widows and the widowers of people that have been lost, knowing that we're just a couple truckloads worth of broccoli and a few million tablets of probiotics from trying to make a dent in this.
Mm-hmm.
And I got to tell you, Gwen, what you said was very heartening to me, and what Lorraine said was very heartening to me. And I wrestled with this, for the past 2 weeks, wondering if I was in a position to make a public health recommendation. But the more I researched it, I realized that throwing some vegetables at this problem at the community level in every community and throwing on a probiotic is not going to hurt anybody. First rule being do no harm. And the second rule is it may save some lives. So this is actionable. This is something we could all do right now if we had the resources. And it occurs to me, everybody I'm looking at on this screen are my resources. So thank you all very much. Let's do something. Let's make this happen.
Thank you so much for your enthusiasm about this, Dr. Davin. I actually worked on a project in Rochester where that was sponsored by a health organization, FLIPS, the Finger Lakes Performing Providers System. We were doing working with helping not-for-profits deal with social determinants of health, and a food bank there really started working with doctors to talk about food as medicine.
Right.
And I think that you're certainly on a webinar with the right organization, because the Syracuse Onondaga branch of the NAACP is in the advocacy business. So you certainly have some access to some good resources here, as long as with some local state and politicians. And I know that there's a whole movement in Syracuse around issues of food. In communities of color and in low-income communities. So I'm glad that you're feeling inspired today.
I am. Actually, this is the first time my mood has lifted. I told Sherry, she's got her Bible next to her. I got my Bible next to me. I started reading Revelation, and I had to close the book, Gwen, because I was getting scared.
I'm gonna need you to stop doing that. We need you to focus on vegetables, fruits, and probiotics. So
I'm going to tell you all right now.
Some more questions coming up. And so we're going to get back with you, and we want to keep your spirits lifted, and we know that you might have some folks coming to see you, so you hang in here with us as long as you can. And I'm going to just keep moving on, because we're on to another important aspect of this issue that has to do with mental health and well-being. And we're so blessed tonight to have Joan Buckley White, who's the Director of Behavioral Sciences at the Syracuse Community Health Center. I'd like to read a little bit from her bio. Let me just get myself together here. Okay, Joan, where did I put you here? Hang on, I might have covered you up. I did. Excuse me. I am so sorry about this. I misplaced your bio. I might let you tell a little bit about yourself in the saving us some time, and I apologize about that. Oh, I got you right here. I got you. Here we go, everybody. Excuse me, I had a moment. Joan Buckley White is Director of Behavioral Health Services at Syracuse Community Health Center. She is a licensed clinical social worker and a psychotherapist. She has been a trailblazer in ensuring walk-in and same-day access to mental health and substance use disorder services in Central New York. In response to the opioid crisis in the African-American community, she led the initiative to launch the first medication-assisted treatment program for opioid addiction at the Syracuse Community Health Center. I'm so prepared, Joan. I had too many pieces of paper, but I found myself. So we welcome you so much to this evening's event. And we'd like you to share just some information about things that our communities can be doing to just ensure that we stay not only physically and spiritually healthy in a moment like this, but mentally healthy. And if you're seeing some things that are happening to folks in the midst of this, we'd love for you to share what you're seeing and how you're encouraging people to take care of their mental health as well. Thank you so much, and please excuse my bobble there.
Okay. You are forgiven, Gwen.
Thank you so much.
And thank you very much to the NAACP for inviting me. And I actually want to start out with a very important alert, where the current concern is that the next public health concern will be a near epidemic wave of mental health and substance abuse issues that we will have to address that is related to COVID-19. And it has to do with the prolonged distress, loneliness, affecting vulnerable people with mental health and substance use disorder problems. So I wanted to get that in there first so that we can begin to be prepared in terms of how we have to address these issues. So overall, across the general population, what we're seeing are people who are stressed, very stressed. And we could get into all the reasons why people are stressed, but stress doesn't care why you're stressed. You are, and it needs to be addressed. Right now, we're seeing very elevated and numerous ways in which people are stressed, but I'll speak specifically to the COVID-19 negative impact on our patients we serve at Syracuse Community Health Center and elsewhere. And those are the patients that receive mental health and addiction services. They are affected in their mind, in their bodies, and in their spirits, because all of that is connected. We're a whole person, one person, but we have a mind, we have a body, and we have a spirit, and those are negatively impacted now because our patients all across central New York, they no longer have physical face-to-face contact with their therapists and counselors. People are essentially more anxious, more depressed, more lonely, and likely to relapse. That's a huge, significant issue. We have individuals who may see their symptoms beginning to get worse, even though they were doing well, especially individuals with pre-existing trauma issues. That is getting worse. This includes actually children who receive services through our school-based health centers. The health center, however, I want to make this very clear because the health center is often ahead of the game. I could be biased and say always, but the health center is often ahead of the game in terms of how we act proactively and make sure that there are services to our patients. So one of the things that the health center has done is to put telemedicine and telecounseling in our system so that services can take place remotely for our patients. So right now, in order for patients to receive therapeutic care, they can call the health center and be linked telephonically with services, which is extremely important, and patients are indeed utilizing those services. So in terms of what can people do, I would say reach out and get help when you need it. Stay hopeful, look ahead. This too will end. COVID-19 won't last forever. People can pray. For those who are of faith, they can meditate. They can listen to uplifting music, dance in place by yourself or with others that you live in the same household with. You can watch things that make you laugh. Laughter is so important. Turn off the negative TV, because there's a loop where it could just be going on and on and on, and then people get depressed, people get anxious, people get confused. Use social media, but use it in helpful ways where you can stay connected with family and friends, make a phone call to someone you think about, but you never reached out to them. Do self-care. That is so important, especially for mothers and single mothers who are now home with their children, and they have to be the teacher and the caregiver, and often some of them work and they have to do that when they get home. So self-care is extremely important, and self-care could be anything from sitting down quietly and having a cup of tea, having a nice bath, or just doing things that you enjoy, that you can do, that is not going to cost you anything in your home. Get creative. Find a new hobby. Pick up, it could be crocheting or knitting, something that you do that can keep your mind focused on something else. Write a journal. Document how you feel as you go through every day in this COVID-19 and what's happening. Chronicle what's happening, how you're feeling, and so forth. And reminder, talk about what you're doing well. Often we talk about the negative aspects of mental health and recovery, but talking about what you do well is extremely important. I challenge people, even people on this panel, sit down and write 10 things that are positive about yourself, who you are as a human being, who you are as a person, and the individual would be challenged. But I really encourage and challenge people to do that, to look at the good things about yourself. And again, I just want to repeat that, know that this won't last forever. Hope is important. Hope is that thing that let us look ahead rather than just focusing on the situation that we're in.
Thank you. I'd like to just quickly ask you something, and then we'll get right with Elisa and into our questions. And again, I want to thank everyone who's sending questions. We're really in good space for time, so I think we'll be able to get to as many of them as possible. But you know, I actually work with executive level leaders throughout my practice, and my clients are centralized in New York, but they're across the state, and I've been asking them to, I work with them on managing change and thriving through it. And as part of my work, I read an article by a man named David Kessler, and it was in the Harvard Business Review, and the title was, "That Discomfort You're Feeling is Grief." And could you speak to a little bit, if you could, Joan, about that, this feeling of that, you know, people are saying, I just feel off, and it's very similar to the Kubler-Ross five angles or 5 stages of grief. And I'm really talking to my clients about that, because I think we only think of grieving at times of death, but I think significant changes like this that are imposed on us also put people in that space of grief. Can you mention something a little bit about that, that people might be, that discomfort they're feeling might be that they're grieving the loss of what their normal was?
Certainly, and loss of freedom is extremely significant. People can't move about as they used to. Not feeling safe is also part of the off feeling, because individuals, there's so much information we're getting day after day about COVID-19 that we didn't know last week, for example, but we're hearing new things now. So of course people feel off. So the first thing I would say is to own it. Acknowledge that you're feeling off. Talk to others about feeling off. Reach out for help professionally to get someone to help you to process that off feeling that you're having. But the first place to start, indeed, is to acknowledge it, reach out for help, process it with family and close friends. But because it is real, this is off time. This is a time, as you mentioned in your opening, Gwen, where we have seen nothing like this before. So people are off. People are concerned about their jobs and unemployment and childcare and food and all those things that the other panelists talked about. These are times of fear. And so one of the best things to do when you have fear is to acknowledge it. But what we have to be careful about, though, is that we don't stay focused on the fear. And we could get into a whole discussion about cortisol in the system and those other good brain chemicals that we need to have in our brains that will help us think clearly and process some of these feelings. But so I would just start with that. Acknowledge the feeling and reach out to process it with someone.
Thank you so much. And I will make a point of sending a link to that article to the panelists and also to the NAACP so that they can share it. And I would also say that it's important for us to be having this conversation with our children. I asked my grandson the other day, how do you feel about the coronavirus? Which he laughs me. There's this hip hop artist, Cardi B, who says it in a very funny way. And my grandson now thinks that's the way you pronounce the disease. But I asked him, he's 5, and he was able to say to me, you know what, Dee Dee, I feel mad and sad. And we have this interesting conversation with a 5-year-old about his feelings. So I think often we dismiss the mental health or the emotions that children are going through at a moment like this. And Joan, I'm so thankful that the Syracuse Community Health Center has these services available to young people, because teenagers are grieving their everything about this is counterintuitive to what a teenager wants to do. So I think as parents and grandparents, we really need to pay attention to their needs as well. And we're going to have my grandson watch the Sesame Street special with Dr. Gupta on CNN on Saturday to kind of create a space for him to talk about that. You know, when I was talking with Linda Brown Robinson about this event, she was really focusing on this wanting to be a conversation for communities of color, for Black and brown people in the community. And we're so excited that we could also have with us this evening Elisa Morales, who is the Executive Director of the Spanish Action League of Onondaga County, Inc., known as La Liga. And La Liga is a comprehensive human services agency that serves 5 counties and has been a cornerstone in the community for 50 years. Ms. Morales is a proud survivor and advocate for others that are experiencing domestic violence and abuse. Elisa was born in Lorraine, Ohio, to parents that immigrated to New York from Puerto Rico, whom inspired her profound pride in being Puerto Rican and American. Elisa, thank you so much for joining us this evening. Welcome. Thank you so much. And we wanted you to share from your perspective, how is COVID-19 impacting the communities that you're serving?
So, you know, one thing that I can say is that COVID-19, it doesn't discriminate. It could happen to anyone, anywhere, anytime. It's like a weather system that just hits community to community, city to city. So, you know, this pandemic has also revealed or reminded us, I think, as a society, that America is not, it does not have the same opportunities for everyone. We're seeing it even more so now within our Latino communities. So we can't solve a public crisis or pandemic for anyone if we can't solve it for everyone. So recent statistics show that about 70% of Latinos are now out of work here in America. About 1/3 of our deaths in New York are Latino people. And about 6 million of our American citizen kids have at least one parent who's not documented. So something that we found is that there are challenges with mixed status families where one person is documented and the other one is not. It's affecting them more so now financially because they're not able to benefit from, let's say, the stimulus that a lot of other families and their children or parents and their children are able to benefit from to help them out. Also, you know, early on, we identified like 10 cities where information was not being shared with people who are migrants. So like our farm workers who are working hard to put fruits, vegetables, milk, whatever we need at our grocery stores, you know, they're working hard to get that food on our table in our grocery store so we could get it on our tables. And so we early on were able to collectively work with a lot of different state and local and immigration services so that we can make sure that we could fill those gaps. Because there's probably about, I believe it's like 60% of the kids that I know of, they don't have access to internet. Their families don't have that. So the internet right now is a huge resource of information and misinformation as well. And we know how our communities work, like telephone. One person puts something out there, and by the time it gets to a few more families, we may have a totally different pandemic going on. So really, it's just really important for us to have, not just in the Latino community, but in all communities, access to services, access to information in those different languages so that, you know, people who get the information that's accurate can go ahead and they can start sharing it with people in their communities as well. So also, you know, a lot of people in my community, obviously they're concerned about food, they're concerned about losing their jobs, but they're worried about paying their rent and their mortgage. So even though there are these deferrals, which are a temporary fix, you know, these amounts are still accumulating. So what happens in 90 days if we're still not working? You know, how do we pay that when we haven't gotten any, we didn't get the stimulus, we aren't able to go work, or someone else in the family maybe lost their income. So there's a lot of those concerns. I think one of the challenges is that I don't think collectively we are collecting data accurately, even, because there are a lot of Latino people, myself, I have very light skin. People might just categorize me as white if I go into a medical facility. I consider myself a woman of color. So yes, I was born here in the United States, but you know, I'm very Puerto Rican, and that's how I consider myself. You know, I do prefer Spanish, to speak Spanish over English, even though I make up a few words. But of course, you know, there's a lot of people who go and they don't have translation services. They're using their children as interpreters. That's a really big problem. Our children are great ambassadors. So if we're giving them the right information that's kid-friendly, they will share that information with their parents and their extended families, because we do have multi-generational families all living in the same house. So I think one of the challenges also is if someone in the household with 3 generations test positive for COVID-19, now they're sent back home and they're supposed to self-quarantine, and then you're putting at risk the entire family unit. And most of the times the entire family comes down with, you know, with the virus. So it's a lot of different challenges. I think that now that we're in the middle of a census count, it's important to be counted. So we all have to make sure that we do our own census, but that we encourage others to do it as well. Just because the pandemic is here, it doesn't mean that the census is not ongoing. You know, these are resources that are going to impact our communities at some point. So we have to make sure that all of our communities are participating. Politically, this helps us with representation as well. We need our voices to be heard. We also, you know, this year is an election year. So, you know, getting out there to be an informed voter, and also just getting out there to vote. Unfortunately, within my community, where there are thousands of voters, well, for example, in the last presidential race, just in our own community, there were 4,000 people who were registered to vote, but less than 400 of them actually showed up to vote. We can't do that. So we have to be part of the communication, you know, process that is successful in us flattening the curve on this pandemic and on other issues like the health disparities that we're also facing. So, you know, there's a lot going on, and there are a lot of people who just don't have that information because, one, I have a lot of illiteracy within my community. So if there is something out there that's written, you know, they rely a lot on visuals. So if there's something that we could get out there that's not just a flyer, that has also some sort of visual, you know, like about wearing the mask and, you know, how that impacts whether or not we're spreading or protecting ourselves. You know, these things are really important, and there never honestly has been enough language service. It's the biggest gap in my community and other communities that speak other languages as well.
Thank you so much. Thank you so much. And the questions are coming in, and some of the questions, Elisa, are coming in Spanish. Okay. And it's not my first language, but I'm going to have you open up the chat, and I think between the two of us, we can get everyone's question answered. So I want to say that as I've been listening to all of our panelists, you know, this thought's been going on in my mind, and I've been saying this a lot just with my own social media posting. I fundamentally believe that we're all in this together and that we need each other to survive. And I truly believe that the solutions to everything that communities are facing are the answers to those challenges are really within us and in the community. So it's at this point I'm going to go out and see what the folks who have been listening and watching are wondering or thinking about, and I'm going to ask the panelists some of the questions that have come forward. If they're specific to someone, I will certainly do that for you, direct them to you, and if not, I will do my best to just put them out to the group or direct them to someone who seemed to have a theme in their speaking. So let's see, I'm going to open the chat. One of the things, and Elisa, I'll get back to you, I thought I saw something come up, but someone wanted to ask Dr. Davin if he could be a little more specific about the type of probiotic he might recommend for low-income folks.
Gwen, in the studies that I've read, lactobacilli and lactococcus were determined to enhance the interferon response to viral infection. So I went to my local Walgreens the other day and I perused the probiotic aisle, and I found a bottle with, I think, 60 million bacteria per capsule. And I made sure that it had lactobacillus in it. I couldn't find one with lactococcus, but we know that if you get the lactobacilli in there and a whole broad spectrum of probiotics, that it will enhance your innate immune response, your interferon response to a viral vaccination as well as a viral infection. But as I said, as the women in my life who know nutrition, unlike me, I didn't learn any in medical school, keep telling me a probiotic does you no good without a prebiotic. And that's why I love your idea of community nutrition-based solutions. It's cheap, and talk about getting bang for your buck. You could spend $15 on 60 capsules of a really effective probiotic with a lot of different species of bacteria in it. So that's my response to that. I hope it worked.
Thank you so much. And also, again, this is being recorded, so people have an opportunity to get information, and people can also follow up with the NAACP, and when it's appropriate, we can refer you out to our panelists as well. Here's something else, and Pam, this might be a question for you, but I would invite anyone else to respond to this as well. This person posted, I work with people of color in my job. The hardest part of the virus for most of them that I'm talking to is the lack of access to unemployment. They can't get on the system via web or by phone. I've been hearing a lot about this as well. So Pam or anyone else here that, I don't know, I think the mayor might not be there. Would you be able to shed some light as to what someone could do to kind of get help with this?
This is very unfortunate. You're talking about a technological system that was recently had 60,000 claims per week that goes to over 1.5 million. And unfortunately, with many systems that we have around the state, they're antiquated. We have upgraded and we've added staff with the state in order to take the calls. It's been communicated that everyone will be able to get their back, pay to the date that they started the claim. But it unfortunately takes time. People don't want to hear that when the phone calls are coming and the bills are coming in. People don't want to hear that. But it's unfortunate that just the vast amount of claims that are coming in. That is the #1 call that we get in our office. We facilitate conversations through the Department of Labor. It's not a preference system. Just trying to go through folks saying, have you talked to your landlord? Have you talked to your creditors? Let's walk through, what do you need today? Yes, we want to make sure that you have funds, but what do you need today? Can we facilitate? Do you need food? Is there a childcare situation? What is the issue that we can navigate through? And I think that's the uncertainty of the tens of thousands of people who are waiting to get information back. And unfortunately, when they say you're going to get a response in 72 hours and 2 weeks later you haven't gotten that response, that leaves people just feeling desperate. And we have people crying, literally crying on the phone with my staff saying, I don't know what I'm going to do. And we walk through, like I said, with them, the steps that they need to go through. They, had originally the unemployment that they filed for. Now that there's the pandemic unemployment assistance that's supposed to make it a little bit easier instead of going through the traditional unemployment. The Department of Labor is a New York State government entity, and they every single day are having communications with legislators like myself around the state. They're working through this. That's not what people want to hear, unfortunately. But like I say, call my office, call your legislator's office, and we'll walk through together what we can do to make things a little bit easier as we're going through this process.
So Pam, can you just clarify something for me? Is this an issue of technology? Is that what the problem is? What that's causing it to be so difficult for people to
Originally, yes, that was originally the government is not the place that has high technology. I mean, there's still, and those of you who work at maybe SUNY Upstate and other places, you know, we have people who still input paper, you know, time sheets. So this is not something that there's like high technology in some areas, and it wasn't meant for that many people. And should, you know, we have been more proactive? You know, probably yes. I guess, you know, thinking that there was going to be a pandemic coming and 1 million plus people would be looking to unemployment, nobody would have thought about that. But this is unfortunately one of those unintended consequences. But it's also the sheer volume. I mean, these are state employees who obviously are now working from home, who are processing unemployment claims, and they've added thousands of people to help facilitate this, and obviously that does take time.
Great. So it sounds like it's being worked on, but I also think the things you can do sort of in the meantime are really important. And we have someone who just joined us. Hi, Sharon, how are you? Good. If we can unmute Sharon's mic. This is not Ben Walsh. I'm sure you all know who this famous Syracusan is. Thank you so much for joining us. We're glad to have you here.
Pleasure.
So, Lorraine, I might ask you to address this. Pamela, you might know something about this, but as I mentioned, I live in Auburn, New York, and I'm married to a corrections officer. And as the Department of Corrections is trying to figure out how to deal with COVID-19 in the context of their facilities, this whole idea that people are being released from the prisons under certain criteria is coming forward. And Lorraine, when you were speaking, someone asked this question. Are individuals being released to the street, or are individuals being released only who have a safe place to stay once they get out?
Well, that aspect, I am not aware. I think that they're being released to the street. And those are non-hardened criminals. You know, they stole something or the marijuana issue. And so they are safer in the community than otherwise. And it's criminal to keep those people in there and putting them in danger of getting this disease. I mean, it's criminal to let anyone get this disease at this time and point. But as I understand it, the process is to allow those, there are two systems. One which allows temporary release until things can be corrected, and then those who are just outright let go. So it's a process. It's something in process, in working process. But we have those who have died already, who had served their practically, and I mentioned that at the beginning, they had served their term, but because of glitches in the system, were not yet let out, and then they ended up getting the COVID-19, the virus, and dying in there. And that's a crime. So,
Pam, do you know anything about that as well? As you're right in Albany, I'm sure where this issue is being talked about as well. Can you add some clarity to what's happening to those folks that have been incarcerated that are now being released?
There have been repeated conversations with the different committees relative to corrections, and with the corrections docs commissioner. There have been different pieces of legislation that have been drafted, circulated to throughout the membership to give to the governor, and we're basically asking, my legislative director was on a call today, that they're talking about releasing inmates within 9 months of their release date. So people who are supposed to be getting ready to be released, you know, it's only in a few months, you know, we should be able to release them. We're not talking about violent or sex offenders. So that's important to note as well. And there is no result of higher crime because these folks are being let out. And so it's going through, unfortunately, a bureaucratic process, but I get calls in my office from parents who have children in state prison who are getting calls from other people saying, we hear that your, son who's an inmate, has been transferred with COVID, and they're not able to get any information. We have to be able to have more information flowing, and that there's definitely pieces of legislation that we have crafted to make sure that we're saying, hey, these people who are ready to get out and low-level offenders, please let them out. This pandemic is not going to go away. When we open up the economy, it's going to be in waves and coming back. Perfect opportunity now, especially since the majority of people incarcerated are people of color. Perfect opportunity right now to be able to get some of these people out of jail where they don't need to be.
Thank you so much. Dr. Schiano, I'd like to ask you if you could help us with this one. He's like, what are you talking about, Gwen? I did a teacher thing to you. This question has to do with, are we getting to the point where testing can be given to non-symptomatic individuals?
We are moving in that direction. Again, we know that in order to control this better, in order to open up our local and entire national economies, we need to test. That's been proven. Right now, the concern is for not only just tests, making sure we have enough tests, but enough PPE to actually perform those tests. PPE meaning personal protective equipment, for those who may not know what that means, having the appropriate gloves, the masks, the gowns, in order to be able to do the testing the right way. We have to make sure our frontline healthcare staff is equipped and we have enough of that protection for them. So that, I think, is where we're running into more of why are we not just testing everybody? We need to be able to make sure we have enough supplies to do that. Otherwise, that would be the ideal situation going forward. And I also want to mention, Dr. Davin made a great point as well about the food insecurity and the way that this issue affects people's guts, which we know the gut does help to run our immune system. It's the main driver behind our immune system. And one of the things I've been telling my patients has been to use things like yogurt itself is a good alternative if you don't mind that. Things like Activia is the only FDA approved yogurt that has been approved for antibiotic associated diarrhea. But other yogurts that I like to use are things like the Wegmans pre-probiotic yogurt. They're like 2 for $1, 3 for $1 over there right now. And those themselves can help with your gut flora. And also in the African-American community, there are studies that show that they have an increased risk of low vitamin D levels, lower vitamin D levels than Caucasian people. And the vitamin D, as we know, also goes back to the gut and absorption and helps with our immune system. That also, in addition to what Dr. Davin was talking about, taking vitamin D every day, a 5,000 unit, 2,000 unit, in conjunction with your doctor, but taking that vitamin D can help also to boost your immune system right now, where it's very important for our immune systems to be where they need to be. So.
Thank you for providing ideas that are affordable for the families and people at our community, because we really want to encourage people to eat healthy as they possibly can in a moment like this. Dr. Brangman, you might be able, this was a comment that was made, but maybe you might be able to add some additional insight to this. So one of our participants wrote in, all nursing home staff can now be tested, and testing is beginning to happen in nursing facilities. Do you have any insight about that or reaction to that?
So yes, 2 things. Just a quick follow-up. So many African Americans and Latinos are lactose intolerant, so yogurt and milk products don't work. The other thing is we're starting to find out that African Americans don't necessarily have low vitamin D levels. They have low circulating vitamin D because people who come from high sun areas where vitamin D is made in the skin have to have protection so they don't get hyper or too much vitamin D. So we find that African Americans have more of the bound vitamin D that is attached to a certain protein. And the current tests only check the free floating. and Caucasians or European descent people have more of the free floating. So as a result, if you check a vitamin D level in an African American, you may get a falsely low level. So this is a case where our healthcare system is missing an important factor in people of color because we do a one-size-fits-all. So I have to talk to my patients who do not want to eat yogurt or any milk products because it makes them sick. And so we have to get creative in getting them calcium and getting their gut health going. The other thing about nursing homes is, yes, there has been a new site opened up, I think in Walmart in East Syracuse, that's specifically for testing nursing home staff. That's very important, but you see it just opened up. So we have a lot of catching up to do because the nursing home patients are stationary. They are in a fixed setting. And so the people who are bringing it in are the people who are working there. So that's why it's so important that we test everyone. Food service workers, delivery workers, nurses, nurses' aides, because they are potentially the ones bringing the virus into a facility.
Thank you so much. And if you see me smiling on occasion, as everyone's talking, Dr. Davin has given us stars, so letting us know that we're doing a good job. So thank you so much. We all could use a little encouragement. Got our own little personal cheerleader here with us. Thank you so much. Dr. Brangman, I just would like you to say something because you did mention about the lactose intolerant. So I might have missed this. Did you mention that instead of using a dairy-based or a lactose-based product, what should an African-American person do to get those probiotics or prebiotics?
So I would then encourage, as we heard, of some more of a vegetable-based diet. And that's very hard because a lot of my patients can't afford fresh produce or they don't live in an area where it's easy to get. We all know grocery stores that are out in the suburbs have excellent produce selections, but or even eating foods that when you have the greens, they're not saturated with high fat, high cholesterol meats, which has been a cultural way of getting vegetables in. We have to talk about adapting diets for current needs. And there is no mystery about hypertension and diabetes and obesity are high in African Americans. There's a big stress factor behind hypertension and diabetes. It makes our bodies produce stress hormones when you have constant stress. Poverty is a stress, racism is a stress. That increases cortisol levels. Cortisol is an important chemical our body makes when it's stressed, and that makes your blood sugar go out of control. It makes your blood pressure go out of control. It makes you get insulin resistance. So this is all connected. These are all issues that were way before COVID that we have to start looking at.
Thank you so much for that. You know, I, as I mentioned, I'm very much so involved in the Go Red for Women movement as a result of my youngest sister dying suddenly from a heart-related matter. As I'm paying attention to the diseases that I observe disproportionately impact communities of color, one thing that really strikes me is that many of them are related to stress. And let's just say racism is a historical stressor. My friends always kind of laugh, but I do think we have historical trauma that we're dealing with. On top of all of these things, everything is really connected. I was wondering, Joan, if you wanted to make that connection between this physical piece that Dr. Brangman's been talking about and our own mental health and well-being.
Yes, certainly. So essentially, so that everyone can understand, with African Americans, we're constantly in a state of fight or flight. So it's multi-generational. There's a multi-generational impact of history and racism on people of color, particularly African Americans. So if you think about it, if generation after generation after generation, you have individuals that are stressed by racism and all the factors that go with racism, and someone mentioned, or several people mentioned earlier, about the social determinants of health. That has to do with where you live, where you work, where you play, where you go to school and all, where do you have a playground that children can play in? So this starts from even in pregnancy, where African women, African-American women are more likely to die during childbirth. So stress is an important factor. And that's why I said earlier, stress doesn't really care what you're stressed about. Of course, you have to address what it is. But with African Americans, it's so historical and it is so multi-generational that we also have to bring to bear all those social determinants of health that we really need to talk about, and where our elected officials or community leaders, community individuals have to take a different focus, the more sustained focus in terms of how are we going to address these issues. Depression, anxiety, where African Americans are told not to tell anyone your business. And so they keep these things to themselves and don't go to seek help as much. We have issues around loneliness and alcohol abuse and other substance abuse among every level of the developmental stages in our African American communities. We haven't talked about suicide and all those other issues that need to be addressed. And Gwen, it is so multifaceted that I'm actually hoping that out of this can come a very concentrated focus that's going to address some of these issues and how we need to put systems in place to address those issues, not just in terms of talking about it, but like I think Pam Hunter or someone said, I'm not sure who said it, someone said we need to keep, or actually I think it's the New York State NAACP leader that says we should keep our politicians accountable, because if all of us are in this together and we're talking about what we didn't talk publicly before, is how these negative health indices affect African American people, I'm hoping we're going to move forward and really look at how we could put systems in place to address it.
Thank you so much. Elisa, I'd like to invite you into this conversation as well from your community's perspective. Elisa? There you go, thank you. Because I totally hear you, and of course from my own cultural perspective, I have a high level of awareness about issues of mental health from my community and frankly from my own personal experiences as a Black executive woman who's under pressure all the time. I tell my mentees that all my friends, we go to church, we have great doctors, and we do therapy. So I'm encouraging our people to do that. But I know that, this certainly plays itself out in a specific way in that community, the African American community. What are you seeing with the Latino families that you're helping in this arena as well?
So we are finding more and more that people who are calling our number, because we've converted our regular office line into a 24-hour information and service line. And we're finding more and more that people are feeling that isolation. They don't know how to deal with it. There were some people who were already a little bit isolated, some of our elderly people, but now they don't have their families visiting them, at least once a month or touching base with them. So it really has had an impact. And, in my community, a lot of times we don't talk about our mental health. We should. There should be more awareness. Some of it's pride and some of it is because of religious beliefs, because we should all have our faith in God and things like that. So there is an influx in calls that are really more about people seeking emotional support in that moment than anything, else. That we do have the call for the food. It's a lot of overwhelming calls for different, they've got to apply for unemployment. They need help. We're helping people with that as best as we can. There's nothing out there that people aren't asking for, but the mental health piece, we don't normally have volume of calls that revolves around people that are stressed out. Working people who are not working now, they're stressed. People who are in the house, in their homes, they're not used to hanging out with each other like that. They're busy people and they don't know how to really cope with that. Parents with kids, some of them, as I said, are illiterate, they're not educated, and now they're having to kind of co-facilitate with a teacher with the school district. They're finding that they're struggling with, different things. I am not good at math. I can't imagine if I had small kids and they had math homework, I might lose my mind just with that alone. But people are definitely afraid of what this virus is, how people are so, it's so contagious, and that it really is like this invisible enemy that's just waiting for us to come in contact with it at any point. A lot of people are afraid of dying. Some people who are here who want to get back home, maybe they're from another state, maybe they're from Puerto Rico, they're worried about their families in their own countries because their countries are also impacted by this. So it's hard when you have your distance between you and you can't even take a flight to be a support to a parent who maybe is now homebound and is very sick with COVID-19. I think that in my community, one of the things that is very overwhelming is that these deaths of their loved ones not being able to be there for them in those final moments, not being able to attend funerals, or, maybe thank God for technology for those who have it. They're able to maybe help support each other a little bit through like Zoom meetings and things like that, but it's not the same. And so people are really hurting. And I think that when the dust settles and we emerge to this new world and new way of doing things, a lot of sad people are going to be sadder, a lot of mad people are going to be madder, and a lot of people who thought they had their stuff together are going to be feeling a little lost. And we don't have in place what we need in Spanish or English for the new overwhelming pandemic of mental health needs that are going to emerge from this. I mean, we are already seeing it.
Right. Thank you so much. So, one of the things too, and I'm just going to, offer Linda, I'm sure you're going to do this anyway, but if we can also make sure that when this recording goes up, that if somewhere on your Facebook page, there's some contact numbers for people to reach out to get services, the mental health services they need. And I know, Pamela, I think the state is also offering some free services as well. I know I'm referring all of my clients to them. And again, my clients are all high-level leaders who are under this exact same pressure. We're all talking about how there's a point every day we feel like crying and we almost don't even know why. So the mental health piece of this is very, very critical. And again, if you weave it all together, what we're eating, where we're living, who we're around, everything is connected. I had a question about if there's any distinction in a concern that we should have about an elder or a family member with disabilities who may be in an institution versus someone that's being taken care of at home. What can family members in those homes do? And I will open that up to Dr. Schiano or Dr. Brangman. What would you say?
So if you're taking care of someone at home, we usually suggest you designate one or maybe two people to provide that care so that you're limiting the traffic in and out of the house. The other thing that's real important is for those caregivers to have masks and or gloves and to wash their hands frequently. The other thing is to figure out a way to make contact with the primary care doc if there are any issues that come up, because you don't want to immediately go to the emergency room. You want to get that screened first, because the emergency room right now can be problematic. Now, clearly, if somebody's having a stroke or a heart attack, they should go, but you can't do your normal back and forth travel to an office or to the emergency room right now if you're taking care of someone who's high risk. I try to tell my patients, I know that your grandkids are home, but this is not the time to babysit. We know that a lot of children can be COVID positive with very few signs and they just go about their day, but that could really threaten the life of my patients who are high risk. So we have a big tension between schools being out, essential workers who are often single parents having to work and no one to watch their kids. But this is not the time for the vulnerable, high-risk older person to be doing it.
Thank you so much. Dr. Schiano, do you have something to add to that?
I agree. Universal precautions right now are extremely important. My recommendation, if there is an elderly patient at home that cannot be easily accessed to a testing site, we've used some home services. We used Essentia, I know, as one of them, to test a few patients at home that we couldn't get to where we needed them to get for the testing. So if there's somebody that needs to be tested, they can contact their doctor, who can sometimes set up a home testing if they're highly suspicious or concerned for a family member.
Thank you so much. Deputy Mayor Owens, I have something I'd like to direct to you. She's like, what you talking about, Gwen? Hi, how are you?
Hi.
Thank you so much for joining us. You know, this question has to do with collaboration. And how has collaboration impacted the local response to the COVID-19 pandemic? So would you be willing to speak to that a little bit?
Absolutely. This is not the time for territorialism. The virus doesn't care what town or village or city you live in, what county you live in, what state you live in. So I can say without reservation, the Onondaga County has gone into full-on emergency management mode. The city has set up our own emergency mechanisms amongst all of our departments. You can understand that through this pandemic, we have to be about the business of continuing to keep government and municipality services going. I thank everyone that gave shout outs to our sanitation workers during the week we were trying to recognize them. Can you imagine if they as essential workers were not out there picking up our trash, we would have yet another health crisis going on. So the collaboration with the county, the collaboration with the state, collaboration across the board with the school district, all that went into even preparing for all the meals that are being prepared every single day and distributed 3 times a week now, coordination with the county for deliveries through our not-for-profit partners. And I cannot say enough about the not-for-profit agencies that are out there. When we think about who are the heroes of our community, and we think about socioeconomic disparity, and we think about the people when we go into the grocery store and the drugstore and the people behind those counters, and they are the heroes that are keeping us going. They keep our groceries on the shelves. They keep our prescriptions ready for us. In every aspect, collaboration, I'm really proud of Onondaga County, City of Syracuse, Central New York, and how we are collaborating. The mayor was on a multi-county conversation just today to talk about, you dare to think about what's on the other side of this pandemic, but we should be thinking about it, but we have to let the data drive what we do, and we can't make rash decisions that don't line up with the data. But hopefully there'll be an other side of this at some point, and we have to be prepared to get our people back to work, to get our children back into the classrooms, to keep ourselves going. So I can't tell you how proud I am as a community, the outpouring of love from our residents, from everyone who's been trying to help individuals get to food or get to shelter. Imagine, being homeless at this time. Imagine being in a shelter and being afraid about, any individual coming into a facility who may be positive or not symptomatic, but contagious. So you all should know from the federal level, our federal contingency, our state contingency. I will have to say we're quite disappointed that local government on the state and local level were not included in that stimulus package. If government, the county executive said it today, imagine the health department and what it would be able to do or not able to do if not for the county's ability to manage and to give Dr. Gupta all the resources she needs to operate in. And I can't speak enough for that lady. She has been a rock star in this. And so it is important for government to continue to function. And I'm proud of our community and how we've been doing that.
Great. You know, one other thing for you, Deputy Mayor, there's a collection of questions that are coming in that are under a theme. That certainly there are populations of people in Syracuse, in the city, and primarily I'm thinking about this, that may not be have as easy access to information, specifically people mentioned folks that are addicts, people who are homeless. Is there a coordinated communication strategy happening to try to get information out to those folks, and are you leveraging the not-for-profit sector as part of that process?
Absolutely. The Task Force for Economic Development, and this isn't necessarily in line with that question, but it gives you an example. When we were the mayor was pulling that together last month, the usual cast of individuals were part of that, whether it was MACNY or Center State CEO. And I said, you've got to get the Human Service Leadership Council in that conversation. Not-for-profits are major employers. Not-for-profits are the safety net of everything going on and supporting people on the ground. And so absolutely making sure that they are viable. I was so pleased that so many of them took advantage of the stimulus packet availability of the PPP and taking advantage of those resources. We have to keep them up and running. They are vital. The coordination on that between going through the Human Service Leadership Council, we're really trying to push people. There are multiple hotlines that are available to people, but you're in a crisis. You don't have time to think through 1,000 different numbers. So we're really trying to push through people to use 211. And through 211, you're dispersed to the various different numbers, knowing the hotline number, coordinating with the county for deliveries to the seniors. So the coordination through that, please, even if you're not necessarily in need, but want to help, go to 211, go to the United Way. They have a volunteer, they're managing all the volunteers. Also, our philanthropic community is coordinating itself through the Community Foundation of Central New York. They raised, I believe it was about $1.4 million. They're still taking donations. I sit in on those calls that those resources are being distributed to not-for-profits all across our community in order to provide services to our residents.
Thank you so much. And again, we're, the participants, you all have done a great job at getting people's juices flowing. So there's a number of questions that'll come in. I'm going to try to get to as many as we can. While I take this next, we have someone who's calling in to speak a little bit more about what's going on with the prison population. But while our colleague, John Moss, is getting ready, somebody requested that we come up with like a top 6 list. So as part of the wrap up, we're going to turn it over to Bishop Colette Matthews to do an inspiration. But if you could tell our community one thing that you would encourage them to do right now, please prepare to do that. And we'll use that as our wrap up. And then Bishop Colette, I'll have you come in and give us some inspiration, okay? So Sharon, Sherry, if you're ready, you can ask Mr. Moss to join us.
Hey, good evening.
Good evening.
How's it going? It's really good to hear some really familiar voices. So Linda asked me to quickly join. I really appreciate everyone hopping on and all the insight we have here in CNY. My name is John Moss. I'm the Central New York rep for Attorney General Tish James. I wanted to quickly share a few things that we're working on. Primarily, Linda had asked me to provide an update on prison cases, which I know was a big topic earlier mentioned. Similar to nursing homes that another colleague mentioned, prison cases are extremely hard to track, and there are really some troubling stats going on right now. The AG's office is really, really interested in following this. We've actually even sent some inquiries around the state. Some of the stats that are coming back are showing that approximately 70% of tests that come back are positive. And I know testing is an issue across the state, and we're trying to pump in some resources to really increase testing in some of these prisons. It's like everything else, it's really hard to follow and to track. And so if anyone on this call and in the audience has any insight or questions or concerns or comments, Linda Brown Robinson can easily share my information, and I'd be happy to connect them with anyone. One other quick thing I wanted to go over, and then I'll pass it back to Gwen, is we're also really concerned about the PPP program and some scams and fraud that we've been made aware of as some businesses and not-for-profits and churches are going to apply for the PPP program the federal government has put forward. You know, there's a lot of bad actors around the PPP program, promising higher interest rates and also helping people apply for the program that shouldn't be doing so and are ripping some of our fellow New Yorkers off while going through that process. And so if you hear of anything more on that, please also connect with me. Again, I just want to say thank you for doing this, and I thank the NAACP and my other partners in government for putting this on. And I share our great Attorney General's wishes with everyone, and this too shall pass. And I will turn it back over to Gwen.
You for calling in, and we'll make sure that your contact information is made available. So we are sliding into home base. I'll use a little sports analogy since we have none. But I would like to just really quickly say that I'm appreciative that John Musk talked about the PPP programs and the impacts that this COVID is having on the small business community. I am a small business owner, have been an entrepreneur for 40 years. And I would also encourage the NAACP, when you have an opportunity, to either maybe pull together another conversation or to leverage your resources and advocacy power to make sure that small businesses in communities of color are also having access to the funding that's available. I just watched an interesting news story about that minority business owners aren't feeling that they are getting equal access to the funding that's coming down. And so that's another important thing. So I always believe that it's important to wrap up on a positive thing. And one of the requests that came in that I think it's great is I believe that we can help people move to action. I love a call to action. So I'm just going to go by the names of the panelists and ask each of you to share. If you could inspire our community to do one thing right now, what would it be? And if you hear somebody say yours and you just want to say, I'm going to give them an amen or ditto, please feel free to do that. I won't make you speak if it's repetitive, but please feel free. So I'm going to start with Dr. Schiano. If you could encourage the community to do one thing, what would it be?
Togetherness during this fight.
Thank you. Dr. Davin, besides eating the vegetables, fruits, and taking the probiotic and a hit of vitamin D, what would you encourage people to do?
You know, Gwen, I spent all day trying to avoid getting infected, but you have infected me with your enthusiasm.
Oh, thank you.
And I'm very grateful. And my words of hope are dime con quien eras, dire con quien andas, y te diré quien eres. Tell me who you walk with, and I will tell you who you are. That is my word of hope, and you guys have really lifted my spirits. Thank you very much.
Thank you so much. Elisa, one word of, if you could, and call our community to action, because, you know, my husband always says we could talk about it, but we need to be about it, right? And I think this is one of those moments we all need to be about it. So what, if you could inspire our community to do one thing right now, what's their call to action for the community?
I would say to please be compassionate and be kind to themselves too. We're all in this together, and it's going to take us all really to get through it and rise above it. But we also have to help ourselves. We're only as good to the people we're helping as we are to ourselves, but we have to be kind to everyone right now. So compassion.
Thank you. And Lorraine, what's your call to action? You need to unmute yourself.
Okay, so I have to say amen to that, because without the compassion and caring for each other, you know, we're just looking at our own selves. So we have to look at the big picture. We're in this together, and we have to fight this together collectively so that we can get to the other side and be better.
Thank you so much. And Joan, what would you, one thing, a call to action for the community?
Hope. Hope is an action word. And actually, as I'm sitting here, I'm thinking about Kizmika Corbett, who is a 34-year-old young African-American woman who is currently leading the fight for developing a vaccine for corona. And African-Americans are people of hope. And so I would encourage people to know, to look ahead. This too will pass, but we have to look ahead for ourselves and for our children and generations to come. So we must have hope so that we can get to it and do the work that we need to do.
Thank you. Assemblywoman Hunter, what do you want to call your district action to do? What do you want to call them to do?
It's the job of the able to help the unable, that everyone has capacity to help doing something, whether it's picking up the phone and checking in to say, hey, how you're doing? Our veterans groups are doing that all the time. You know, sending a letter to someone, asking if they could drop off groceries, you know, just saying, hey, I love you, hugging your family every single day, and just saying, you know, how grateful you are. That is something every single day that we can do.
Thank you. Dr. Brangman.
So I would like us to be creative and think of ways we can maintain our social contact while maintaining physical distance. I think that there's going to be some need for physical distance for a while, and I want us to focus on the most vulnerable people in our community, mainly older people and kids.
Thank you so much. And Deputy Mayor Owens, if you always call on the community to action, but do you have something special on your heart right now?
I have to ditto Dr. Bragman. We're getting people are getting weary. We're so over this, but this is not the time to give up. This is not the time to give up. We've been doing what we're supposed to do. We've been social distancing. We've been reaching out to one another, push through the pain. Don't give up right now. This is not the time to give up. I'm so proud of every single one of you.
Thank you so much. Well, I want to say that, you know, I've been really inspired by being given the opportunity to moderate this panel. And Bishop Colette, you can unmute yourself because I'm calling on you now. But I would just like to wrap up and say some themes that, you know, emerged for me would be the importance of advocacy, the importance of being politically astute, the importance of staying socially connected while we're physically connected, that self-care isn't selfish, and to be involved in that, to keep your mind on your money and your money on your mind, to make sure that you do your best with your financial resources, asking for help. And also, I would offer too that if there's never been a more important time for us to be politically astute and politically aware, that we do need to hold people accountable for leveraging our tax dollars to do what is best for all of us. And it's important. The NAACP has been doing that for many, many years. And Linda Brown Robinson, I want to thank you all for inviting me. But I think, you know, a major theme is that we have to keep our spirits lifted. And I'm so thankful, Bishop Colette Matthews, that you were willing to join us this evening to do that. I know that you smiled when I said, I love Jesus and I do therapy. I was going to call you and say, what do you think Jesus is going to say to me about that? But I would love for you to close us out with some uplifting words, because this is a very, very dark time. And, you know, I always think there are cracks of light in darkness, and this panel is an example of that crack of light. But I'd love to know what's on your heart to wind us up this evening.
Well, the last stanza of the Black National Anthem says, God of our weary years and God of our silent tears, thou who hast brought us thus far on our way, thou who hast by thy might led us into the light, keep us forever in thy path, we pray. And so as we seek to navigate through the tumultuous challenges and uncertainties of the COVID-19 pandemic, I'd like to just offer these closing words of comfort and encouragement for all of us to become ambassadors of hope. And I'm so grateful to have heard that theme through it all, because at the end of the day, that's really what it boils down to some days, just having hope. And so hope is seeing light in spite of being surrounded by darkness. Hope is the expectation and deep desire for things to get better. Hope in my faith tradition is the confidence in the sovereignty and will of a faithful and present God. And so it is my reflection this evening that all of us would become beautiful ambassadors of hope by harnessing the best of our beloved community, by having renewed compassion on, understanding for, and solidarity with those who are hurting and feel left behind. And so by lifting up our collective voices, we have the power to bring glimmers of light and love and monumental hope to each other, to our neighbors and to our communities and even to the world. And so I believe that hope will ultimately make the difference in whether we live or whether we stop breathing. And so I'd like to close with just taking a moment of silence for all of the families who have lost loved ones and for all of the souls that we've lost because of the COVID-19. So we could just take a quick moment of silence for all who have been suffering and going through this horrible pandemic together. And so as a member of the faith community, we hold all of you in our hearts very dear. We are continuously praying and uplifting our community. We commend all of you and all of us who have been in this fight. To our elected officials, we thank you. To those in the healthcare industry, we thank you. To all who are just continuing to stay in this faith, in this fight, we thank you. And I know that we will get through this together because hope is powerful. God bless you.
Thank you so much, Bishop Matthews. So I'd like to close on behalf of the Syracuse Onondaga branch of the NAACP. Again, this is Gwen Webber-McLeod, who served as your moderator. I am so thankful to have had this opportunity. And I'd like to close on a note. I want to let you know that Linda Brown Robinson told me to take it away. Do you have some closing remarks, Linda, before we go?
Thank you. Whenever I put the call out, Gwen answers the call, and you certainly have answered it tonight. So thank you, Gwen.
You're welcome.
So as this town hall comes to a close, I want to thank our esteemed panelists, our elected officials, my compadres in the NAACP, but I certainly would probably be remiss if I didn't thank some of the people behind the scenes. Our brand new health chair, Mr. Williams, our first vice president, Gwen Morg, who no one sees. She's behind the scenes filtering the questions. Colette Matthews-Carter, who's our third vice president, and Sherry Dozier-Owens, who doesn't like to be out front, but she made this all happen, ladies and gentlemen. And this certainly could not have happened on my watch to get all the electronics. So thank you very, very much. But somehow Gwen Webber-McLeod must have seen my notes. And I don't know how you did it, so I have to walk around my place to see if there's a bug in here. Because on May 28th, the Economic Development Committee for the NAACP, Syracuse Onondaga chapter, will put on another town hall on the economic development and how it has impacted our small businesses, minority businesses around the city and the county. So mark your calendars, ladies and gentlemen out there. On May 28th, we will have our economic development team bring you their feelings and how this has affected the impact of the small and large businesses. So with that said, thank you all again for joining us. Gwen Webber-McLeod, again, I can't thank you enough. I owe you a debt of gratitude. And thank you, panelists. We certainly couldn't have done this without you.
So thank you so much, Linda, and sorry for getting ahead of you a little bit. I was very being conscious of the time. So this, the last thing that I would leave all of us with is that, as I mentioned earlier, I am in the business of supporting leaders in all walks of life. My clients are parents and CEOs of major international companies. And we talk about in my company, leading with your head, heart, and your spirit, and doing that by being confident, competent, courageous, and calm. And I think if there's never been a time in our lives as leaders in our homes and in our community that building those competencies of confidence, competence, courage, and calm are going to give us what we need to stand on our feet and lead with our heads, our hearts, and spirits as we do all of the things that this amazing panel has invited us to do. Again, we are in this together. We need each other to survive. I've decided to develop a personal relationship with COVID-19. I call it the Rona, And I would like to end by saying the Rona won't win, because we are going to get through this together. And thank you so much. Again, the NAACP reported this. They will look at the questions and make sure that those that didn't get answered. I hope we got you some good tips that you could walk away with. And thank you so much. I'm going to be lifting you all up in prayer and sending love, light, and supportive energy your way. We got this. The Rona's not going to win. Thank you and good night.